Hi, welcome back to the Sense Kaleidoscope podcast, where Akshay and I are talking about autism and changing the narrative around autism. Today, we will be discussing various therapies, schools of thought, strategies we use to help the students on the spectrum at SK uh, cope better with the real world and overcome their difficulties in the best way possible. Akshay?
Thank you for that, Vauhini. Let's start with setting some context because we work very specifically with a certain group of people with autism. And I want to define that before we start talking about therapies and what makes sense and what doesn't, and why we agree with something or why we don't. We know that the students that we have dealt with came with the diagnosis of autism. Obviously, that's one of the first things that we look at. But over a period of time, we started to get other labels on the table as well. We looked at labels like anxiety, depression, bipolar. OCDs is, of course, a given when we are talking about autism. One of the difficult labels that I think we both have dealt with is ODD, that is oppositional defiance disorder. And of course, we have also managed autism and schizophrenia. So, do you want to chime in a little bit about autism and mental health and this connection and what's going on over here?
So I think when we welcomed our students into the space and we started working with predominantly an eclectic approach of conventional therapies like ABA or TEACH or I think Greenspan and floor time, not that much because you work with younger kids on the spectrum with that philosophy. Right. But predominantly ABA and TEACH, plus a lot of common sense, a little bit of the ABC of the cognitive behavior therapy, so on and so forth. We saw that as children were growing into their teen years, there were hormonal physiological changes, and that understanding of these changes that was happening in their bodies was not easily comprehensible to the students on the spectrum. That I feel that was the largest change that happened, due to which we started seeing changes in terms of added anxiety or depression because I'm not able to understand what's going on. Okay. While they kept growing with us, there was a lot of, because of this, there was a lot of trauma, and that trauma kind of also manifested in different ways, whether it was just trauma or whether it was also mental illnesses like, bipolar or schizophrenia seeping in. It was a new world for us. It is not something that I was equipped to handle. I was definitely not certified to handle. And it came as quite a shocker for me to see these manifestations in a child I had known so well without these labels, at the time. So we had to change significantly, dig deeper, find out how we could cope with these things, handle them better, and support them better.
Absolutely. While you were talking, there was a quote that was coming in my head again and again. So it says, autism loads the gun, the environment triggers it.
Yeah.
And that's why autism is no more just a genetic condition, it's an epigenetic condition. And you were talking about how the environment that is not understood by the individual, whether it is a physiological change in what you are saying. But of course, with our work, we also know that it is not limited to just the hormones kicking in. We also know that the fact that a 11, 13, 14, 15-year-old, if is functioning cognitively like a 6-year-old,
right,
then there is a huge problem.
Because there's a bodily mismatch.
Correct. Can you expand on that?
So your body is a 13-year-old's body physiologically, but your mind is not able to, is fighting this cognitive dissonance because your mind is functioning as a 6-year-old, and a 6-year-old is not expected to understand why there are so many bodily changes.
Yes, and also the fact that the emotional world, that aspect where I have to understand about big emotions and small emotions, and the way we break down when we are working with younger children. Today there is a lot of talk about getting primary school children to understand empathy. There is workshops, and there are curriculum modeling that works on, let's talk about our big emotions. Let's learn how to deal with that. We couldn't do any of this stuff.
It was difficult because, first of all, you know that a person on the spectrum lacks the theory of mind. A theory of mind basically is, I do not know what it is to be in your shoes, and I do not know how you feel about a certain situation. I only know about myself. Okay, simply put, that is theory of mind. So they lack that. But apart from that, there's also, they are in the presence of other people. They are in the presence of different environments, right? I see my peers, my sister's friends, people who come over, who look like me, who are of my age. They seem to be very, comfortable in their own skin, comfortable with their emotions, comfortable with technology. And I'm not allowed these things in terms of maybe, able to exploit technology where my peer is able to. And this is something that we've seen a lot nowadays. Like, he gets the phone for so many hours, but I don't, because you don't know how to regulate yourself. And he does. And that is the difference. But even that is also hitting their self-esteem in a big way. In a big way, that they are not able to understand why XYZ is given something and I am not.
Can I say that because of that, you gave an interesting example, but if you actually look at that example, where I do not understand where you're coming from, and if I'm so core focused on just my needs, my desires,
Sure.
and what works for me without understanding the true consequence of those actions. Because at the present moment, I think that being on the phone and playing that game or watching that same video multiple times is something that's working for me. What is the long-term consequences of something like that? I do not have the ability to comprehend it.
Right.
As a teenager. Which is why then there is, if it is pulled away from me, I'm having a meltdown.
I'm having anxiety,
Correct.
then I'm depressed that I'm not getting the phone.
Correct.
And that goes into various other stages. And that is where it has been for us for a lot of teenagers.
Yes. And when you talk about that anxiety, it's basically the memory of that happening, that I'm not getting it.
Right.
The access can be taken away. That just the thought itself, we know, can kind of ignite or trigger the child. Now, I want to bring us to the idea of what we essentially did at SK. We said that okay, we understand that there is cognitive regression and that needs to be fixed, because otherwise we cannot do things like CBT. We cannot imagine going into a space where we can say, okay, let's think of even counseling. And we know that counseling is a very integral aspect of learning to deal with repressed trauma. The other aspect that I think became very obvious to us because of the lack of that theory of mind in the students is where they were constantly in that victim phase. That whatever is happening to me, what I'm undergoing is wrong and it's not acceptable. They were not able to evolve from that phase.
Correct.
And I strongly believed, and I remember both of us had conversations, and I told you, they have to be able to make meaning of this and they have to be able to evolve through this. And our task as a team, who's going to go into modification or who's going to go into management in any which way, is to ensure that we will help them move through that. Right? Now, if I have to take us back to therapies, and we are going to now outline some, you already named some of them.
Right.
You've spoken about applied behavior analysis, that is ABA.
Which is predominantly positive reinforcement.
Expand, please.
So when a child has succeeded at a given task, you respond with a high five or good job or a token of appreciation, be it a potato chip, which is most common.
Yes.
I don't understand why everybody on the spectrum is a foodie, but yeah, sure. Yeah, that works brilliantly. So you do that constantly. So there's ABA. It has worked. I think there is a subset of ABA. Within ABA, there's something called discrete trial training.
Correct.
Where, you are teaching the student OPEX, for instance, which is a picture exchange communication system. where you are showing a picture, the child, tells you what the picture is, and then you immediately reinforce with, say, a chip or a high five or a good job or whatever, and the child learns through that method. So these are all teaching methods where you're using basic human instinct, where the child understands that I want something because I want, and my need for that is so high, I will do what you ask of me. And then you train the child to communicate through that, and slowly, reduce the reinforcement, in the sense, instead of every trial you give it at every third correct trial or fourth correct trial, and then you go on to a star method, and then there are various ways you do it. So that's been used to be a hallmark back in the day. There have been other opposing thought processes that have come off it. I guess each to their own. If something works, it works. It doesn't work, doesn't work. But then there's teach. Teach is focused on structure, adapting the environment to the student to ensure that there is a visual structure, there is a predictable routine, and hence the individual is made comfortable and hence functions in a certain way.
So is the hypothesis.
So is the hypothesis.
Yes.
Okay. So there's these are the two the most rampant schools of thought. However, there have been newer schools of thought that have come into being. Both you and I have adopted, pairing or bonding as the core philosophy of SK or my work or Aksha's work, because of the fact that that has taught us more. And when you look at working with younger kids, say whether through Greenspan or Sunrise, the core of that is to bond with the child.
Play-based also.
Right? So because it is bonding with the child, that core of that philosophy is what we've adopted even in the adult stage of our students. And that has really worked wonders for us so far.
Let's go back to actually what is happening. I do want to spend some time of ours in understanding, helping everybody who's listening understand what actually happens with these techniques. And we are talking teenagers.
Right.
You defined what is done with children. Let's say between the ages of 2.5, 3, as early as
Right.
start with early intervention, and then moving on to like 7, 8, 9. Okay. That many years are spent, let's say, practicing ABA, which you have defined. And we all
teach for that matter.
I'm going to go with ABA for the present moment. We know that food is a huge
reinforcer
for obvious reasons for most children across the globe. Now, in the teenage years, I want us to kind of like reflect on this aspect. If I'm going to give you reinforcements continuously for you to do a task for me, what are the consequences of that in a teenager's mind? Let's bear in mind that from the age of 2 to 9, this is the system that I have been following. And now I'm 11, 12. The world also changes. The way the world perceives me changes. I'm not a child anymore. I'm a teenager. I will still seek that reinforcement from you, by the way. And I will seek it at that rate that you have been giving me. Now, while you were breaking down the discrete trial training, the truth is that still
it's an exchange. Yes, I agree. But the thing is, what I said was, you do it after every 3 trials, then 5 trials, then star, then whatever. Today, I am working with the hope or with the motivation that I will be able to get a salary at the end of the month, or I will be able to help the next child that walks in, or grow my organization, or get that salary and go on a holiday. All of us require some amount of, reinforcement and joy from the mundane, right? It's not that everything, me waking up in the morning cannot give me joy. Me waking up in the morning to see my dog gives me joy. So the excitement to wake up to my dog's face is my reinforcement.
Absolutely. You're talking about the weaning of method. Now, the pushback that is happening for ABA from the community of neurodivergence is where I'm trying to bring the conversation to.
Right.
And the pushback is happening because I hope we do understand that this conscious weaning of process that needs to happen may not always fall into place in the way that it should.
See, I think I spoke about this in the previous podcast, where I said we will have to have a multi-pronged approach for behavior, it is multi-pronged approach to learning, to skill building, to building cognition, to everything, right? When you are doing a weaning off process, okay?
Can you
need
define
to,
that a little bit more?
So, I mean, as simple as I'm doing it at every successful trial, after every 3 successful trials. Now, after every 3 successful trials, I get a star. Then the reinforcements also, you're taking off. Yeah, and you also move to, it's not just food, it's going to be a movie. Okay, it's not just a movie. I will also have to build new likes.
Correct.
Right? The child's interest cannot be stagnant at just food or a potato chip or a cookie, or a piece of cookie, whatever it is. While you're building that, you also have to move from that potato chip to the movie or to, at the end of the year, a holiday or to visit your grandparents or whatever it is, that gives that child joy. You have to build those things. You have to keep exposing your child to new situations, see what he or she likes, and build on that. You can't just be stagnant at the chip phase or the...
Absolutely. And that is the movement that is very important. Otherwise, we will see the consequences that we have seen in teenagers, where if that reinforcement is pulled away, then the anxiety goes up.
Sure.
And it's going to consistently stay up, which is where we are going to then walk into a label, another label that we hopefully could have avoided.
Sure.
Correct?
Yeah.
Okay. Teach, of course, talks about structuring predictability and has been used very successfully as well. I know that there are others like the sensory therapies. There is OT that everybody very uses it quite rampantly. There is speech therapy.
Mm-hmm.
The PEC system today has been
by some
the AC systems where the tabs have come in and so on and so forth. And with technology, we have the ability to do way more than what we used to. If we can move into timelines for these therapies, and what is the way to kind of understand the impact matrices when you are working with therapies? Would you be able to define that? Would you be able to help us understand, okay, if I am doing a therapy, what kind of timelines as an educator do I maintain? How do I understand when I need to make the flip? Do I move from here or do I not?
See, I think it's very individual. Again, coming back to the thing, you need to know your student and you need to know what you're doing and dealing with. You need to have a wholesome approach to everything that you do. So I cannot put a timeline. Yes, the ABA method focuses on, say, an IEP, which is an individualized education program with short-term goals and long-term goals. While you might have a macro goal and say, okay, have I achieved what I wanted to achieve? Should I shift? Should I not shift? It's a very clinical research procedure. If it works for you, great. Otherwise, if you say, okay, this is the long-term approach, and my method has always been sitting with the parent and saying, okay, where do you see your child, say, 10 years from now? And then backtrack and backtrack and backtrack and backtrack and then build on that and then bring, short-term goals for myself as an educator.
While you've also set the long-term goals, because you said
I start with the long, so I'm saying I start with the long-term goal. I want so-and-so person to become a person who can function in a neurotypical environment, lead an independent life, earn a certain living, earn his living and be independent, and that's it. That is my long-term goal. Now I say, okay, how does he want to do this? What are the interests that he has? How do I backtrack? So I have to backtrack from that, and that's really helped for me. Now, whether I use, there are, a full, we started, I remember, even with SK, with full product schedules for visual schedules. Like, you have a shelf and every shelf has the products that you have to, rather the material that you have to take out, finish in terms of a schedule that we were using. Then you move on to a written schedule.
correct,
right? But some people come and tell me, hey, can he not function without a schedule? I'll always say, why? Why should a person function without a schedule at all? I have a to-do list even today. There are people who can function without it. Well, good for them. But my life is more organized and more comfortable because I'm doing it. And am I in the process of having it? Is it cumbersome? Am I harming myself? Am I being difficult on myself? Am I being difficult on a person who is going to assist me in this process? No. Then yes, please go ahead with anything that we do. If a person needs a walking stick for life, they need a walking stick for life. Why are you insisting that they have to walk without a walking stick, right?
Fair enough.
So I'm saying whatever therapy we are using or whatever method we are using, you have to use it consciously.
Yeah.
You have to know that, your long-term goal is your goal. How are they going to be independent? How are they going to be without this? Right? Without constant human intervention. They might find a counselor. They might not find a counselor. They might find happiness only with me. They might soon be in love with me and obsessed with me. That has also been something that we have seen, right? How do we wean that off? How do we make sure it doesn't happen? All these things, you need to keep that check and balance in your head and make sure that you are on the right track.
Absolutely. Tell me, does therapy have to be looked differently from education? Do we have to separate these two things? Because in India, I've always come across this where parents will say, okay, my child has to go to therapy. And somehow that is a different format from education.
It's basically the educator possibly is not empowered or does not want to add on that responsibility within themselves. I don't think it is possible. Okay, because you are looking at a wholesome scenario here.
Correct.
Right? You are looking at making sure the individual is independent. Now, independent what? Not just with their ideals, which is activities of daily living, but with everything. Is that individual financially independent? Is that person emotionally independent? 90% of neurotypical world itself is not emotionally independent. Right? We are depending on other people for happiness. Most of us. And we are trying to wean off that. So you want this individual to be able to function means that you want to be this all in all for that person. I'm not saying a person is capable of being an all in all, but are we working in as one cohesive whole? And it is difficult to separate yourself as an educator saying, I cannot do anything beyond just, a cognitive skill building activity. And that's it, right? You have to work on 5, 6, 7 interventions in parallel to address 5, 6, 7 facets of the individual's requirement.
Yes.
So while you're saying you can separate it, I mean, if he can get additional support, for sure. But it is my job as an educator to empower myself to be able to understand that individual and provide that support within my own repertoire and my own process to ensure that it is most efficient.
So what you are saying is that actually the holistic approach and that is the multi-pronged approach that you keep talking
Correct.
about. If we are able to bring these various things together, and I also believe that very strongly, like one of the strongest reasons why SK functions in the way it does is because I'm inspired by Jiddu. Jiddu talks about education and healing being together, therapy and education going hand in hand. And if we are not able to provide that holistic environment, way of pedagogy, implementation strategies, then we are necessarily not doing either. When therapy is integrated in bits and pieces in a curriculum, and that is what also happened in Scotland, where I was working. If a student was in the classroom, if there was a need for sensory, there's sensory play that can be integrated into your classroom. You can do a 30-minute slot where sensory play can happen with a group of children. You do your core subjects because literacy is important. Understanding how math works, English works, grammar works is important. Otherwise, I cannot articulate, I cannot do any of those things. Then moving into social skilling, because I understand that autism finds it very difficult to navigate through social situations. If there is a possibility of putting it all together, then would that not truly be the holistic approach of working with therapy and education? I want to also touch on the aspect of distress versus disorder and why therapy and education actually need to integrate. Can you shed some light on autism the disorder and autism the distress? Can that be defined?
There is a neurological wiring or central nervous system wiring that is different, due to which functioning in a neurotypical world might be difficult for a person with autism. that is a disorder. When the environment I am living in, this neurotypical environment, not only because of my CNS wiring, but just like any other neurotypical human, is frustrating because of an emotional response from triggered by the environment. That is a
Distress factor.
distress factor.
Can we break them down into examples so that we can start identifying what is the active role that the environment is playing? Say, for example, I'll start with an example and maybe you can add on. If I am 11 years old and I have always been hugged as a child, okay? No consent asked, nobody said, may I hug you or anything like that, but just like, oh, so cute, you're so cute, and then hugged and done consistently. And then when I turned 12, I was told, no hugging, please.
Mhm.
Because it's inappropriate now.
Right.
You're a teenager and there are body boundaries. And then the concept of body boundaries is brought into the picture. And I do not agree with it. So, is it the disorder? Is it the distress? What?
I think it's distress. I think it was not done right from the beginning. Right? Like we spoke of sensitivities earlier, and we spoke about the proprioceptive sensitivity, where you want that feeling of being hugged or pressed, and you have these when you go for occupational therapy, you have these machines that are crushers which will help you kind of feel that, and you feel good
about it in her book very extensively.
Yes. So now, as an alternate to that, when the child comes and seeks the hugging bit, the parent, when the child is 2, 3, 4, 5, like, oh, so cute, like you rightly pointed out, and like, oh, he really loves hugging. Now, at that point, hug time should have been monitored and said, okay, this is hug time. You cannot just run. And then you start pointing out and saying, okay, these are the people you can hug. Okay. And then you cannot hug a stranger. You cannot be, vulnerable and manipulated by someone else. You cannot put yourself in a vulnerable situation ever, or a can be manipulated situation. So these boundaries, I think even in the neurotypical world, this right touch, wrong touch, bodily awareness, I think it's being integrated, thank God for that, into mainstream society as well. And I think it's very important to do it with our kids as well, to ensure that this is done. If you had done it right, then it would be classified as a disorder. The fact that you just woke up when the child was 12, okay, and as if he was kind of hugging you inappropriately or hugging another person whom you didn't know inappropriately, and that you just turned around and said, hey, this is not okay, that should have been done earlier, so that becomes a distress situation.
Absolutely, because for that individual, that hugging means I'm regulating. You take away this hugging aspect from my life, I do not know how to regulate anymore.
Correct.
And along with that comes, now I don't feel loved. I don't feel valued.
And that's where now all the mental illnesses are coming in.
Correct.
Yeah.
Correct. The reason I was trying to point at this is because we are seeing such a huge rise in the
mental
number
illness.
of mental illness coming in sync with autism. You and I know that this is really on the rise, and something from what we have done with our work. You've worked in Canada, I've worked in Glasgow and in Edinburgh, and that part of the world. We did not see
I didn't see any. In fact, I didn't see any. No, in fact, I didn't see any.
I did see a few, yeah.
I didn't see any. I also worked in a fairly sanitized environment where, I didn't see addictions and stuff like that. But I think I started seeing at SK for the first time. When I assessed an individual, I was just like, oh my God, what am I dealing with here? And I think the individual was over 20 years old. And that was the first time I saw it, And then I had to reevaluate what I was doing. And I said, hey, I'm not equipped for this, Then now, this was about close to a decade ago.
Yeah,
and
very much.
Now I think any person who is not on the spectrum also is saying, hi, I have a mental illness these days. I think post-pandemic also it's become a big conversation. So yeah, I mean, autism is no alien to this thing, and we've seen it way before the pandemic. Now we are seeing people even who are neurotypical who are suffering with.
But more trickier, more complicated. At least when a neurotypical has a mental illness, there are ways for that individual to build awareness about his or her condition and to seek help.
Because the lack of comprehension and cognition, I'm not able to reach out to the extent that I could have possibly reached out to a neurotypical. I have to keep devising strategies to say, hey, how do I explain this emotional story to them? Because lack of emotion is one of the triads of impairment in terms of not complete lack of emotion,
correct,
but the ability to understand and process emotions.
Yes,
that
is true. So having spoken about the hugging,
right,
the not hugging, more specifically leading to meltdowns, when we worked, we realized that we had to do multiple things. Let's break down this multi-pronged approach that you're always talking about.
Sure.
The first thing was, that SK follows in 8-hour day, and we work 6 days a week. So that 8 hours is extremely tight. That we have these timetables that are printed in large and children know what to expect. So the predictability factor that Teach has always encouraged,
structure and routine,
predictability, routines. We also gave them choice-making possibilities, which you introduced into the classroom. You said, okay, if you are upset or if you are not able to regulate in the classroom with this activity, then I will give you a choice. And the choices were essentially something that would be appropriate.
Correct.
As opposed to the inappropriate meltdowns that we were looking at.
Right.
Social stories, something that we always do, and a very core component of the work that we do. It is part of our timetable, in fact. Help me out. There are many things that we actually brought on the table.
No, and we also did positive reinforcement all the time, right? Like if the child who was not able to cope through his day, after every hour of class that he was coping, we'd always give him a positive reinforcement, whether it was a good job or a high five or a walk around or whatever. It is not back to back to back. They always get that 5-minute break if they needed it, which was in itself a positive reinforcement. But the good jobs never stop.
Correct.
I don't think the good jobs stop throughout. However, you need to, that also comes down to a large extent, because every time you do anything, you cannot run up to someone and say, hi, are you proud of me? Like, it's not possible.
I mean, we did see that as well.
We've seen it. That's why I'm saying.
We consciously started to work with our teacher training programs as well.
Right.
We also brought that element in, where we trained our teachers and we got them to be sensitized to the fact that please be conscious about what you are allowing in your environment.
Correct.
Isn't it? So again, working with our environments, and many people associate environments with lights and fan and, furniture and stuff like that. No, I think a very, very huge part of an environment is the human being.
Correct. So that's where, we made sure that the teacher was in the right space to work with the child. You made sure that, for every action there was a consequence. So that also came into being. So this is the multi-pronged approach that I keep talking about and advocating, saying you need to do it all for you to be able to see a small change possibly. If you're lucky, you'll see a marked change instantly. I have never seen it, but it happens. So it happens over time, and you'll have to have this approach for you to be able to deliver a holistic education process.
Let me just add, we did not touch upon the counseling aspect.
Right.
Which also was very consistent. If you remember, you would come once or twice every week, and the counseling was happening specifically between identified people.
Right.
That is where we walked in with the ideas of CBT. We wanted you, I remember when you started it, we also had to build a lot of comprehension. So that's another thing. The education also had to tie in.
So you cannot ever dissociate yourself saying, I will do only X or Y or Z.
Correct.
You will have to embrace it as a whole and say that this is my job to help support this individual lead a better life with comprehension and lead a mentally healthy life.
Having said that, autism and mental health, the reason I brought this topic in today about therapies, because where we established ABA, Teach, Floor Time, Sunrise, and all of these therapies, there is RDI that I would like to touch upon as well.
Yeah.
Is used very extensively today. relationship developmental intervention therapy. And in this, there's a very interesting thing that they speak about. They say, as a nurturer, whether it's a parent, an educator,
You need
an
to
adult,
be in the right space.
is your space okay or not when you go in? When I started working in India, RDI was just picking up, and I had heard of it and I had known of it in the UK. However, I still told you many times, and in our experience with the work that we have done with autism and mental health specifically, and knowing the number of cases we have dealt with, I know for a fact that either one of them, picking one of them, would have never helped us. And that is exactly why we said, no, we are not going to do this. We both were scared. Like you said, we're not equipped. How are we going to manage this? But if we didn't do what we did, where we said, okay, we're going to try a little bit of ABA, we're going to take the predictability aspect from teach, we're definitely going to put that in the day setup. We are going to work with ourselves. We're going to ensure that we are okay before we go in. And also it helped us take the decisions of bringing in multiple other people in the process. We didn't do just therapies. We have also done CBT. But CBT looks very different for autism. I want to flag that. CBT does not look or feel like anything that the neurotypical world.
So CBT is essentially cognitive behavior therapy. It works with the antecedent, the behavior and the consequence. There is a certain trigger. Because of the trigger, there is certain behavior. And what is the consequence that happens after the behavior happens? So you work with these three and try to minimize the trigger and try to minimize the consequence and hence alter the behavior. That is how CBT works. When you're talking about building a relationship with the child, and that is a form of therapy that seems to be picking up nowadays. The reason I brought up Greenspan or Sunrise or whatever it was because the relationship was so important, right? About building that bond. But in the neurotypical world, we've always said, fill your cup before you fill another's. You need to be okay before you can help somebody out, and that has kind of crept into this. I think all the schools of all the various schools of thought that have brought out certain methods of helping strategize behavior coping methods are all stemming from very basic rooted behavioral psychologists that have started, be it Freud, be it Adler, be it Pavlov's operant conditioning, be it whatever it is. That is the base. And I think even when we first studied these behavior psychologists to understand where all these schools of thought have stemmed from, also for us to kind of build on it or understand the human mind and then build from there. So I mean, if I have managed to kind of put this together, an individual with autism might or might not have mental illness, but the core of everything is going to be bonding, and the core of everything is to be able to provide a holistic kind of intervention to bring in various schools of thought, understand it, and there is no way that you can say, hey, I'm just going to be vanilla this bit for myself. You will have to equip yourself with whatever there is out there to try and help the individual who is in question.
Agreed. The only way to build resilience, which is what the core focus was at SK for us, and to ensure that the individual was able to move away from mental illness and come towards functioning.
Yes.
As opposed to give into that and then get into medication and the vicious cycle of whatever follows through after that. So listening to whatever you said, it reminds me why we always come back to the idea of resilience over obedience. Why we say environment before expectation.
Sure.
Yeah. We wanted to work with our young adults and teenagers to ensure that they could cope better, they could regulate better, they could reintegrate, most importantly, and thrive. And that resilience does not come from the idea of control. And I think subscribing to one therapy, subscribing to one model, boxing human beings, saying that this formula is going to work because this is a formula that I understand, is not the way to go ahead. And that is where I would like to close it and say that bringing along various styles and being willing to explore and experiment is really important to help people with autism and mental health.
See you in our next episode.